Good morning.
Hey, how's it going?
Good, how are you?
I'm doing well.
Is Kelly joining us?
Yeah, she should be.
Is
I
she
sent her
Bay
this.
City, Washington? 'Cause I have
What's
one.
that?
Is she Bay City, Washington? I have one person in the waiting room under the
No,
title Bay City,
no.
Washington.
She would be Muskegon. I don't think.
Okay.
Yeah.
Everyone else has a name that is not Kelly. There's just one that had 11-Bay City, Washington.
Okay, let me text her and see.
Okay. I'm gonna grab my tea out of the microwave. I'll be right back.
Okay.
Okay, did you get a hold of her? Hi.
I texted her, so I'm just waiting. I'm waiting to hear back.
Okay,
So
cool. I will
double-check
probably
this.
turn off my video at some point because my Wi-Fi is not doing that great,
Okay.
and my voice will start to get echoey kind of and skip. So if you
Okay.
hear that happening, please
Okay.
tell me. But I'm just going to do a brief introduction. I've got the slides pulled up, and I don't think I have your guys' intros on here.
Well, I was gonna say that's okay.
Okay.
We can introduce ourselves.
Okay,
So.
great.
Yeah.
Let's see, slides.
Oh, she says she's waiting for the host, so she must be that one.
Okay, so you want me to, all right, hold on, let me escape out. I'm in the slideshow. Let me get down there. So I've got Nilda, what is this? I want to make sure, Shirley. Oh, wait. I think I admitted her. I think this one says diabetes prevention, so I'm hoping
Yep, there
this
she
is the
is.
right person. Yay!
Yes.
Good morning.
Good morning.
How are you?
I'm well. How are you?
I'm great. I wanted to apologize for the confusion last week. Introduce myself. I'm Portia. I'm the Education and Registry Manager here at Mishwa. What I typically do is an introduction, and then I tell everyone that we'll be waiting a couple of minutes for everyone to join because people usually come in a little late. And I'll ask everyone to do an icebreaker just to share their name and where they are checking in from. And then I will share the information that I'm going to put the link for the webinar survey in the chat at the end of the webinar. Usually we do that right after Q&A if there is any. And so do you guys want questions during the presentation, or do you want me to tell everyone save them for the end?
We can do it during. I want it to be interactive. Yeah, we can use chat function, whatever. It's going to be pretty informal.
I'm going to tell them to use chat just because when we unmute or allow people to unmute themselves during, it can kind of get a little crazy.
Sure.
So I'm going to keep everyone on mute. I will have them add their questions in the chat, and then I will gently invite you to answer questions during the presentation by reading them to you.
Okay.
Sound good?
Sure.
All right, we're going to start letting people in.
Who is sharing the presentation? Are we sharing it or are you?
I have it. If it's easier for you to share it, I can allow you to share your screen. My only problem is we're having some delays in our Wi-Fi. And I would just, sometimes when I click next, I have
Sure.
positive intentions of going to the next slide, but there's a delay. Is my voice going in and out?
No,
It's not.
Occasionally, but it's mostly there. Yeah.
Pretty much I have to climb on top of the computer for it not to do that. I ordered a headset, so I'm going to look like, Flo from Progressive. I think it might actually have come from Amazon. It's in a pile of boxes. I have not had a chance to open yet,
Okay.
but hopefully for the next one I have it. So I'm going to open it up, and then I'm going to tell everyone to start sharing where they're from, and then I will talk about the webinar link. Cool?
Okay.
All right, we ready?
Bring it on.
All right, here we go. Dun 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 dun. Good morning, everyone. Thank you for joining us. We're going to mute everyone on entry. If you're not already muted, please mute yourselves. If you'd like to turn your camera on and show us your beautiful face, we always appreciate that, but it is optional. My name is Portia Fisher. I'm the Education and Registry Manager here at MISHWA, the Michigan Community Health Worker Alliance. We're having a webinar today hosted by the YMCA on diabetes prevention, which we will begin approximately in 2 minutes at 11:03. I wanted to let everyone know that towards the end of the webinar, we will be sharing a link to our webinar survey. You'll need to click on that link and complete the short survey in order to receive a certificate to earn 1 CEU. Please give us about a week, 5 business days to get that certificate out to you. And once you receive it, you will need to upload it into your profile in our registry. So what we're going to do while we wait for everyone to join is please share in the chat who you are, maybe where you work, and the county or the city that you're joining us from. I'll go first. I'm Portia. I work at MISHWA, and I am joining from Oakland County, where it is partly sunny, I would say, trying to focus on the positive, and I think it might be about 50 degrees out there. Hi, Janet. Thanks for joining us. Oh, that's Jennifer. I was going to say we have someone joining from the YMCA. It's Jennifer. Janet's joining us from Genesee County. Always good to see representatives from out there. Anyone else? Just one more minute. Hi, Kathy. Good to see you. I'm glad you got in today. We talked earlier. Family Medical Center of Michigan. Great to have you. We do have all of our CEU opportunities in the registry. So if you go to the MISHWA registry and take a look at CEU opportunities, we'll have all of our upcoming webinars listed. There's about 20 of them in the next quarter. And then we have 26 that are recorded on demand. So you can earn up to 26. One of them actually is worth 4. So you can earn up to 30 CEUs just on recorded webinars. Okay, Margarita's coming in from Berrien County. Good morning, Barbara from Bay County. Carol Costa, hi, Carol. St. Clair County, United Healthcare. Just about 30 more seconds and we're gonna get started. Jennifer, will you be starting or will Kelly? Jennifer?
Yes. Yep. I'll be
Okay,
starting.
great. I've given you the ability to share your screen. Are you going to take advantage of that?
Oh, yeah. Or Kelly, did you want to do it? Because it's mostly your.
Hi, Susan.
Yeah, you're the one mostly talking, Kelly. I'll let you share.
I just talked to Susan this morning. Good morning. She's coming in from Revive and Thrive. Sue from Spectrum Health. Good morning, Sue. Absolutely. Actually, Janet's asking a question about the survey link. It's always the same survey link. So go in once, fill it out for this survey. And then if you attended a previous webinar that you didn't, go out, exit, go back in, same survey link, and just fill it out again for any of the other webinars that you attended. It's always the same survey link. All right, we're going to get started. I'm going to throw it over to Jennifer and put myself on mute.
Hi there. So yeah, my name is Jen Nicodemus. If you were on last month's webinar? I think it was. It feels like a lifetime ago. I talked about the blood pressure self-monitoring work that the YMCAs are doing. So back again this month to talk about diabetes prevention. I've been with the YMCA for almost 15 years. I started off in the Ann Arbor area, and now I work for the State Alliance. I support all the Ys in Michigan to do evidence-based health programs. And so generally, I'm just a good advocate to know if you have patients that are interested in working out at the Y, or if you have other questions about Y programs and things that we do a lot of work in cancer survivorship and falls prevention and arthritis exercise. memberships with scholarships and things. So if people are low income or they need just financial assistance, we have that as an option as well. So if you have any issues or like questions or any patients that might have need, please reach out to me and I can connect you with the right person at the local level. And you can always reach out to your local Y as well. But sometimes it's good to have a warm handoff. So today I'm with Kelly DeLong from the Muskegon YMCA, and we're going to talk again about the work that we're doing with diabetes prevention. So Kelly, were you going to share the slides or did you want me to do that? Okay, sorry.
I think I can do it.
Okay. And I can stall. I wanted everybody to, in the chat box, just so we kind of had some awareness of your experience with DPP, if you could share a little bit about if you've worked with diabetes prevention in some way before, if you have a referral partner for the program, or if you've had patients that have been in the program, anything that you can share. I'd love to kind of read a little bit more about your experience too, as we're kind of having this conversation today. So go ahead and throw any of those comments about DPP in the chat box. I see. Okay. There we go. All right. So we'll go into my slides are unfortunately the more boring slides. So sorry about that. I'll try and keep it interesting. But we'll start with the first slide here. It's the brief history of the Diabetes Prevention Program. So I don't know, Kelly, if you've changed to that slide yet. I know there might be, okay, good. There might be a delay in seeing it. So the YMCA got involved in the Diabetes Prevention Program when it was just after it was created. So in the late 1990s, early 2000s, the program was created and it was super in-depth, super expensive, but it also really worked. And so the researchers were really excited about the work. They had a bunch of people in the group, and maybe you've even seen a little bit about the study and the results from that original study. They gave participants in the program pretty much everything they could possibly have to be successful. So we asked that people participate in physical activity and change their eating habits so that they could lose weight and therefore reduce their risk of developing diabetes. So if the person in the program didn't have a place to work out, they were given a gym membership. If that wasn't working, they were given a treadmill to be in their home or an elliptical. They were provided classes, workout shoes, pretty much everything they needed to meet that physical activity goal. And the same really happened with the food goals as well. They were given everything they needed. They would have chefs come in and help the person one-on-one create meals that would kind of fit the goals of the program. So it cost a lot of money. So they did prove over time, and not a very long period of time, that making lifestyle changes was really effective with helping people reduce the risk of developing diabetes. And so they approached a couple of different YMCAs. I know Indianapolis was one of them, and said, can you take what we've created in this program and do it more cost effectively? So essentially, like, can we make this cheaper to run, and therefore we can, be more likely to spread it across the country? And so the YMCA in Indianapolis took on that challenge and was able to demonstrate that they could get the exact same results, or at least very similar results, for a lot less cost at the YMCA. And so that was kind of how the YMCA got involved in the first place. By 2010 or so, there were at least 50 YMCAs in the country that were delivering the program. Marquette was the first one in Michigan to get involved, and that was back in 2010. And over the years, the YMCAs across the country just kept getting involved. There was, as you may or may not be aware, a lot of grant money coming out of the CDC during the 2000s. So the late knots, so 2008 or so, up until just recently when they kind of made the switch to blood pressure. So a lot of grant money coming out to spread this program and take on the work. By 2017, so in the middle of the decade, YMCAs were given a task to see if we can prove to Medicare that this program was a cost-effective way to help people, again, reduce diabetes and have it be covered by Medicare. And so in 2017, we've completed that demonstration project, and Medicare took on the program. And I think it's the very first program that has ever been accepted by Medicare, that's a prevention program. Most of the time programs are treatments, so after you have a situation, a health condition, then they will help you treat it, but nothing was ever preventative before. So it was really exciting that YMCAs could do this. And there were 17 YMCAs in the country. The study was 2 or 3 years long, because I think the program itself was 2 years long at that point. So it was just really great to know that the YMCAs could deliver this program with fidelity and to a high level that a government entity would pay us to continue doing it. And there are dozens and dozens of organizations across the country that are now Medicare suppliers of this program as well. We'll go ahead to the next slide. Yeah. And so just some basic information about diabetes prevention. Some of the methods that we use to deliver the program, it's all about a program we call Listen First, which I think to the rest of the world, they call it motivational interviewing. So asking open-ended questions, engaging people in discussion. There are no recommendations that we make in this program. It's all about what the participant kind of feels like they can do to reach their goals, and us helping coach them along the way. A lot of, again, reflections and summaries about what those conversations are. A lot of affirmations. We really celebrate every tiny detail of success that a person has, making sure that they continue to build on that success over time. We really try to get our participants to have ownership over their goals. So again, we are never telling people what to eat or what to do for physical activity. We just help them figure out what they think will work for them, and then kind of coaching them to be successful in that area. And if they maybe aren't successful in that area, we talk to them about why and see if we can kind of back up that goal a little bit, see if there's something else that they can try to still be successful in that area, or if they need to just maybe completely change that goal to something that's more reasonable. Our goal, again, is to keep it simple. So we ask that people lose 7% of their body weight, given that they have a BMI or a body weight number that they can actually lose. So it is for people who have weight to lose. And we do that through, reaching 150 minutes of physical activity, and also watching what they eat. And we focus on fat grams in this program. And then we give them a lot of resources along the way as well. So right off the bat, it's a group program. So there's a lot of support from the other participants in the group, and a lot of sharing of ideas. Again, it's our goal as lifestyle coaches not to provide recommendations to anybody, like we think you should do this or do that. But the group can certainly say, hey, have you tried this or have you tried that? And usually when it's a group support, participants are more willing to kind of hear all the options and then make a decision based on what they hear. We also give people a Calorie King book. So again, if they don't have internet access, or if it's easier for them to just use a book, they have that as a resource to look up the number of fat grams that are in the foods that they're eating. So there's no excuse. They can use the internet for sure, but if they don't have that kind of access, they can have the book as well. And we also provide weekly handouts. So we have structured discussions every week about the program and what they need to do to be successful. And then each week does build on the next week. So it's, no, you're okay, Kelly. So it's okay that even if they miss a class, we would want to do a makeup session for that as well. But we want to make sure that they attend as many classes as possible. And the next slide, there we go. So that's kind of the gist of the program, like the very simplest form. Prior to, so COVID obviously really threw everybody for a loop, right? So prior to the shutdown, we had 12 YMCAs in Michigan that were working independently on the program to some degree. Some were doing maybe one class a year that they were marketing for. Others, that maybe had a lot of grant funding, were doing multiple classes a month. They were all, of course, in-person classes because that's all we were allowed to do according to the CDC's guidelines with the program. It was a really hard year for YMCAs. We were closed for at least 6 months. Some YMCAs got to open early if they were in the northern part of the state or the UP, but for the majority of our Ys, it was a tough 6 months. Since the reopening, and thanks to a couple of grants that we had, we were able to be more creative, and I think just more open to the idea of collaborating with each other. So for those that don't know, most of our YMCAs are independent associations. For example, there's the Grand Rapids YMCA that has, I think, 6 different branches, mostly in Kent County, that are all part of that one association. Whereas in Ann Arbor, the YMCA there is a single branch Y, so it doesn't have any other locations other than Ann Arbor. Detroit, again, is another large association that has, again, 6 or 7 branches across the Metro Detroit area. So some YMCAs, most of our YMCAs are 1 or 2 branch facilities. Grand Rapids, Lansing, and Detroit have multiple branches. So when I say a collaboration, what I mean is, in this case, we'll hear more from Kelly today from the Muskegon Y, which is a single branch Y and a really unique facility that they don't even have a building. They just do all outreach type of work. They're partnering with multiple YMCAs across the state, Cadillac, Bay City, Flint, for example, to do the diabetes prevention program. So Kelly is running that program on behalf of those YMCAs and doing virtual classes or distance learning, as the term I think is starting to come around. They're live classes on Zoom, and we've never been able to do that before, primarily because the CDC did not want us to do classes online. So because of COVID, we had 2 really great opportunities. One, to partner with other YMCAs across the state to deliver the program in communities where Ys weren't delivering the program before, and to also do classes virtually, which again, really opened up a lot of doors for people. We're also doing a lot more of something called community health detailing, which is in the simplest form, it's like sales training or sales of community health programs. So it's a specific way to do outreach with doctors and nurses to let them know about the program that we're doing and get them to make referrals to us. So we've been doing a lot of that kind of work. And we've been also doing a lot more electronic referrals as well. So because we're doing more outreach with physicians, we are therefore getting more referrals to the YMCA as well. There we go. And I think, so I want to introduce Kelly here because this is the most important part. Because of Kelly at the Muskegon YMCA, the grant that she has and the grant that I have, we're able to really open this work up to pretty much the whole state. And so I'm going to turn it over to Kelly. She'll introduce herself a little bit more about her kind of background with the YMCA and what she's been doing with her grant dollars.
Thank you, Jen. So like she said, my name is Kelly and I'm based in Muskegon with the YMCA. But because of the grant dollars, we've kind of been able to expand a little bit. But my background, I actually was in healthcare for about 8 years. I worked in emergency and the surgeries and primary care. And so I really understood kind of the clinical and the provider world of this. And so it was a really nice fit for me to come to the YMCA and figure out how we can kind of link those clinical and the community piece together, which I know that you all do very, very well. So back in late 2017, we were awarded the 1705 grant from the CDC, and that funds 10 national organizations, and I have them listed just in case you were curious, to grow and expand the diabetes prevention program. And you can see the YMCA is not one of those grantees. So it's mostly community organizations. And then you can see the very last one is Trinity Health. So it's a very large health system here in West Michigan. They're all throughout the nation. And they had contracted with us as a YMCA because we have been doing diabetes prevention for a while to carry out the work here in West Michigan. And so the goals of the CDC grant were to expand delivery and close those enrollment gaps for those priority populations, which they list as men, senior citizens, African American, Hispanics, and I think colleagues was the last one. So we have 5 main strategies that we needed to accomplish within this grant. So the first is to increase the availability of CDC recognized in the underserved area, which is why West Michigan was chosen. We are pretty dismal on the US health rankings. I think we came in high 80s, 83. No, that's the very last one. Anyways, we're really, really terrible. And so we wanted to make sure that this program was available in those underserved areas. We wanted to increase the clinician screening, detection, and referral. So we always say screen, test, refer. We found a lot of the providers have no idea that this program even exists. We hear a lot about the DSME, so the self-management programs, but nothing about prevention. So it's kind of our second strategy to make sure that providers know that we're here, the work that we're doing, and how they can enroll their patients in these programs. The third one is to just increase awareness in general. So again, the main thing is, do you have pre-diabetes? Most people think, nope, that's not me, and they turn that out. We know that 1 in 3 are at risk for developing type 2 diabetes, and only 90% know of it. So we needed to kind of change the way that we talk about pre-diabetes in a way that captures people's attention to say that, hey, maybe that does pertain to me. The fourth is to increase retention rates for participants. So it's not enough that we just get butts in seats, right? We want to make sure that it's a great program and that people want to stay in that. And I think I have some stats later on in that, but we've been able to do that. And then that last strategy there is to increase benefit coverage. So this is only a 5-year CDC grant. We are in year 4 right now. So we know that in October of next year that those grant dollars are going to go away and we cannot offer this for free anymore. And so that's the last strategy that we need to focus on, is how can we get this as a covered benefit so we can continue to do the work that we've been doing. So here is Trinity's reach within this grant. You can see that in West Michigan, we have 2 locations. So we work with the YMCA in West Michigan, and in Southeast Michigan, we work with St. Joseph Mary's. There's Mercy Hospital in Illinois, Mercy One in Iowa. We have St. Carmel, Ohio, St. Petersburg, New York, and then Holy Cross down in Florida. So it's a pretty wide reach in the Midwest, I guess. And then that's the way that I wanted to show the way that those dollars flow. So it comes from the CDC as that 1705 grant. Trinity Health was one of those grantees, and then they dispersed it to all of those states that you see in green and all of their health ministries, with the exception of West Michigan, where they chose to work with us as a YMCA. And this grant alone just brought $1.2 million to West Michigan. So it's a pretty large grant that they're very serious about funneling some money into expanding diabetes prevention for anyone that qualifies. And then, as Jennifer had mentioned earlier, the coronavirus had brought over the opportunity to kind of expand that reach even further. So with the grant, at first we were restricted to our service area. So just West Michigan, I think we were serving 5 counties. But because of the pandemic, we were able to, number one, switch it to virtual. And then another one is connect with other YMCAs that don't have the funding or the capacity to run the program, but there's still a need in their communities. So the Muskegon YMCA is acting as the umbrella hub for all the other spoke YMCAs. So you can see Tri-Cities YMCA, that's Grand Haven, Spring Lake, Ferrysburg area, Flint YMCA, Shiawassee, Cadillac, Bay City, and then the Blue Water YMCA. And I see there's a question in the chat. Is there any way that we can get this information sent out to us? Jen's got it. Okay, great. It's coming your way. So this is just information that I'm not quite sure is common knowledge, but I have already mentioned. So 1 in 3 in Michigan has prediabetes. So that means they have risk factors that could lead to developing type 2 diabetes if no intervention. So that means they have a higher BMI, it runs in their family, they're relatively inactive. There's several risk factors, and we can go over those. And the worst part about it is that only 1 in 10 actually knows it. So we have to address those other 9 people that are at risk that have no idea. And how do we talk to them about that and get them engaged in this program? We know that type 2 diabetes does come with friends. It's seldom, just a diagnosis of type 2 diabetes. That includes hypertension, heart attack, stroke, heart disease. So we want to make sure that we stop the progression of prediabetes to type 2 diabetes so that all the rest of these don't follow. Like I said, my background is in healthcare, and so I wanted to take a deep dive into the life of the provider and some of the challenges that they face in regards to why are they maybe not referring. So we came up with kind of 4 main chambers here. So the number one is the sheer volume of chronic disease. We know that from speaking to care managers that there's just so many people to manage. And again, it's not just one chronic condition, it's usually multiple chronic conditions. They don't have the time for intensive counsel needed for that lifestyle change, so they can sit and do the finger pointing, but it's really that hand holding that the patients really benefit from. I think I saw a study where the majority of like a 10-minute interaction with a provider About less than 1 minute is spent on lifestyle intervention and counseling as far as diet and nutrition. As far as they have no idea where to get information about resources, they don't know what programs are out there or available or cost. And then lastly, those social determinants of health that we all know and love, they often fall outside of the scope of influences for those providers. So they just kind of stay away from them. So now I'm going to go into a little bit more deep dive about the diabetes prevention program so that you have a better understanding about what the program is, what it does, and the outcomes. So the first thing is that it's going to be a year-long program. We're going to meet 25 times throughout the year for an hour each time. So it is going to be a 25-hour commitment on the participants' point. So it is run by trained lifestyle coaches. We make sure that they go through a lot of prerequisites. They have to do in-person teach backs and then deemed worthy from YMCA of the USA. We keep classes small, about 15 participants. We know that anything bigger and then participants tend to clam up because they think they're talking in front of a big group. But we also know that not everyone that participates is going to keep coming back each week. And so we want to kind of pad that classes for that attrition. The emphasis is on prevention empowerment. It is not a diet nor an exercise program. I think Jennifer mentioned earlier that we would never tell you, oh, don't eat that, eat this instead, because everyone's going to be a little bit different. So it's going to be a lot of trial and error to figure out what works for them. I always tell a story about, we're just going to name her Joanna. She was a participant and she was really, really struggling. She had a really crazy busy morning. She had a special needs teenage son that she had to get ready and out the door and then go off to her full-time job. And so every single morning she would stop at the gas station, grab a black coffee and a banana nut muffin, and then kind of head into her work. And so during the classes, she was frustrated because she wasn't really making a whole lot of progress. And so we kind of use this Calorie King book that Jennifer mentioned earlier that everyone gets. It's kind of helping them look up nutritional values. And so we went through her morning and we looked up banana nut muffin, and it was about 33 grams of fat of her 50. That was her goal for the day. And so the coach said to her, do you like the banana nut muffin? Do you love it so much that you have to have it? And she says, no, it's a banana nut muffin. Like, I thought I was making a really good choice. That should be like fruity and healthy, right? And so what we decided is that, in the gas station, they had like a little deli section where she could get a couple of hard-boiled eggs, bring some bread into work, and she could have toast and eggs. And I think that was only like 5 fat grams. And so she went just from knowing not much about what she was eating to making that one little switch and making a huge difference. So for us as coaches, we're not going to say you should have an all-white veggie omelet, because that doesn't fit in with her crazy, busy, hectic morning routine. So it's just kind of problem solving to find something that works for her lifestyle and that she's kind of willing to make that change for lasting impressions. Sorry about that little tangent, but this is kind of getting back on track here. This is a CDC approved curriculum. So it's been tested and approved over time. And then of course, we have the CDC as well as YMCA the USA looking over our shoulder, making sure that we're running the program as intended. And then we're always required to submit the data. We have been fully recognized by the CDC for 2 cycles in a row now. So almost 5 years that we've been doing this, we've been fully recognized. So that means that we've been able to show outcomes and hit all those measurements that we're supposed to. So the overall goal of the diabetes prevention program is obviously to reduce the risk of developing type 2 diabetes. And we do that through 2 different ways. The first one, we work on healthy eating as a way to lose weight. We aim for only 7% of body weight loss, which most people do hit within, the first 16 sessions. But remember, it's a year-long program. And so the trick is trying to maintain that weight loss throughout the whole year. Because obviously they're going to be lifestyle changes that they're going to make, continuously. And then that second way that we do that is through getting them to move a little bit more. And we aim for at least getting 150 minutes of physical activity per week by the end of the program year. And so again, everybody's going to be starting from someplace different. And that's the great thing about this program, is that it's highly individualized while being in a group setting. So everyone's going to kind of make their own goals, start from someplace different. And then the coach, as well as the other group members, help them work up to those goals. I wanted to put the cadence of the year-long program. So the first 16 sessions are going to be weekly. So same date, same time. And then once they complete those, they're going to move into every other week for 2 or 3 sessions. So that's 17 through 19. And then the last 6 months that we're together, we just meet monthly. Again, so the bulk of that work is in that first box of the yellow with the 16 weekly sessions. And then we want to make sure that they're going to be able to be accountable. We kind of do a test run where we go every other week to kind of wean them off of their group and their coaches to make sure that they can do this on their own. And then those last 6 months that we're together is really to make sure that, they're keeping up with the routines, that, we can have that weekly or that monthly check-in just to make sure that everything's okay. And then we provide that added support. A lot of people have no idea what we talk about. So I also wanted to list those session topics. And depending on if we have some time, I can run you through kind of a little mini session in about 5 minutes or so. But some of my favorite ones, I really like, how to better manage stress and ways to stay motivated. And then also keys to healthy dining out, because I've went through a million different trackers that participants hand in. And I know that that's one that everyone struggles with. They just think that, well, I can't ever eat out again. And that's really not the case. We have, tips and tricks to help them stick to whatever their meal plan is. And still making healthy choices. So these are the program outcomes. This came from the New England Journal of Medicine, and this just kind of shows you the outcomes. So if it was just the metformin, which is the medication that's often prescribed to help prevent or to delay type 2 diabetes, that's 31% effective. The lifestyle intervention that is the Diabetes Prevention Program has been proven to be 58% effective. And then that number jumps up to 71% for those age 60 and older. So who can qualify for this program? They need to be adults, so age 18 or up, and then have some extra weight to lose. So we request that they have a BMI of 25 or higher, and that is lower to 23 if they're Asian American. So we can qualify them 3 different ways. So the first one, if they've ever had a previous diagnosis of gestational diabetes, based on a lab value. So that could either mean an A1C, a fasting glucose, or a 2-hour glucose. And those typically do come from provider offices. Or if none of that's available, we have a quick 7-question CDC risk assessment. It's just yes or no questions that talks about those risk factors. I think it's just a 9 or higher to qualify, and I can qualify almost anybody. I do want to point out that why this is called the Diabetes Prevention Program, we do still allow people with diagnosed type 2 diabetes to participate. I simply just consider them as an auditor of the class and allow them to participate just because it is about eating healthier and moving more. I make sure that I have that conversation with them ahead of time that, the science is going to be a little bit different. So once you're actually diagnosed with type 2, the nutrition behind that changes. And so we make sure that they understand that aspect. But I also ask, is there another family member or friend that has maybe not been diagnosed that you would like to join with you? So while it is for those not yet diagnosed, we do let them in sometimes. Just know that. Here are some of the results that we had up until the end of last year. So we had 536 participants enrolled, lost over 4,300 pounds, 171 average number of physical activity minutes reported per person. My favorite is this 84% retention rate. So remember, this is a year-long program. And we worked really, really hard to make sure that it's fun and engaging and that people actually want to come back. And so the CDC aims for us to have a 60% retention rate. And so we're kind of knocking it out of the park with 84%. Again, we have that full recognition status to deliver this program. And then I wanted to include kind of a little pie chart as far as where our referrals do come from, most being from their primary care office or their specialist. We, part of that kind of creating awareness and helping providers understand that what this program is, we wanted to make sure that people feel comfortable enough to refer into the YMCA for the Diabetes Prevention Program. So many times we've heard, yeah, I made the referral and I just never heard any other thing after that. So we have a really robust provider feedback loop that we make sure that we're in constant communication with anyone that refers. So the way that it works is the provider would send in the referral, and then we contact that participant within 48 hours, and then we make 5 different attempts just because we know that people are busy and it might not be tied up on the list to get back to us right away. Once we connect with them and they decide that this program is a good fit for them, they're going to attend an information session, or we call that our session 0. And so that's where they're going to meet their coach, other group members. They're going to learn a little bit more about the class and have some chances to ask any questions. And then the following week, they'll start a session when we'll actually weigh in for the very first time. Once they attend that, we'll let the provider know that they've been enrolled in the program. And then we include progress updates after session 8. And again, after session 16, when kind of the bulk of the work is done. And then, of course, there's communication throughout the way if the participant, stops coming to class or they drop out for some reason or have to pause. We make sure that the provider knows that. So of the classes, we have morning, afternoon, and evening classes available, which I know was a key to keeping people in classes. That we have to find classes that work for their schedule in order to keep them coming. Now that we're in this virtual setting, we're using Zoom, we're finding that those barriers that we saw earlier about, lack of transportation or it doesn't fit with my schedule, those have kind of dissipated. And then we know that when people say, yes, I'm ready, I want to do this program, that we need to get them in right away. It's a lot like quitting smoking. We need to take action right away. We can't just say, okay, there's another class starting in June, just hold on. So we make sure to launch at least one class every single month to capture those people that are ready. And then to kind of sweeten the deal, we include some incentives. So depending on the area that they're joining from, we can include a 3-month YMCA membership. And that applies to those 6 partner YMCAs with the Muskegon YMCA that I had listed earlier. So the Shiawassee, Cadillac, Bay City, Flint, and I can see you mouthing it.
Yeah, Blue Water and Port Huron.
And Tri-Cities YMCA, thank you. So if they're near one of those YMCAs, we can include a membership to the YMCA to kind of help them meet those physical activity goals that we set. Again, they can get the nutrition information book. You can get this even on Amazon. I think it's just like $8, but there's also a website. And this isn't the end all be all. There's a lot of other things, MyFitnessPal that people use. We can offer them, the choices of a food scale to help them prep food, meal prep containers, cookbooks, exercise bands. They're not Fitbits, but those smart wrist pedometers that help you kind of track your steps, cooking utensils. And then because one of the requirements is that they weigh in and let their coach know that number before each session, we can provide a body weight scale if they do not have one, because that's kind of required in order to participate. So I just wanted to bring this slide up again and just trying to remind you of what those challenges were before the program and how the YMCA is working to kind of help mitigate those challenges at the healthcare providers. So we help to reduce that clinical burden, hopefully by catching those that might be at risk for developing type 2 diabetes. We can kind of stop it in its track and prevent them from kind of going into the healthcare system under case management. We have the luxury of spending those 25 hours of individualized attention with the participants, leading to higher patient satisfaction. And if you remember that feedback loop, the providers are kind of with us every step of the way. They're very informed with their care. And so they also have a hand in that, and their patient satisfaction scores go up as well. We make it easy for providers to screen, test, refer. So hopefully, we give them every tool that they'll need to know that the YMCA is here, this program is available, and this is how you can enroll them. And then lastly, we partner with Pathways for the social determinants of health that may serve us. So again, we're with these participants for a year, and a lot can happen in that year-long program, and a lot of things might bubble up. And so we have a really robust community referral platform in which we're able to identify, any of those social determinants that might pop up and make that referral out and get that taken care of so they can get right back into focusing on their health. So how to refer, we are on Great Lakes Health Connect or MyHIN or whatever it is called now. They would just search Muskegon YMCA. We're in the Epic EMR, and then we can always, take it by secure fax, email, or even phone. So I'm just gonna leave this up here just for a minute. And then we can take any questions that you may have. I know it's a lot of information that we ran through.
Thank you so much for all of that information, ladies. Does anyone have any questions? If so, you can put them in the chat now. I'm also going to share a link to our webinar survey. You'll need to go into the chat now. You can click directly on the link, or you can select it and copy it and paste it into your web browser. It will take you to SurveyMonkey. You do need to complete that webinar survey in order to get your certificate to upload into your profile in the registry to earn your continuing education unit. Today, you'll be earning 1 for attending this webinar. If there are any questions, you can also raise your hand. Okay, we have a question here. Are there any YMCAs open in the lower metro area? I'm assuming that's Detroit metro area, ladies?
Yeah. The Detroit YMCAs, they should be open as far as I'm aware. I can't remember where they're all located. I know Livonia ended up closing their branch primarily due to COVID. But there should, the downtown branch is still open, and there's one downriver somewhere. I'm not sure what the street address for that one, but there should be something.
Okay, great. Thank you. Is the referral process the same for Flint residents? Do you have any flyers that we could provide to our community members in Flint?
I do. I have materials up the wazoo, and I don't know the best way to get them. So Portia, I don't know if you'd like me to send. I can kind of show you real quick. We have these little rack cards with a little scan QR code, so people could just do that with their phones, take the quick risk assessment, comes right to my inbox. It just tells a little bit about the program. So we have these customized for each YMCA that we work with. I'd be happy to send those. I can send referral forms. So yeah, for the Flint residents, we're able to, provide that YMCA membership as well. But
would you like to put your email in the chat so that anyone who specifically would like those can contact you directly? Yeah. I'm assuming that they're all the same. So you would send those same flyers to anyone?
We have the flyers based on which YMCA. So that's the only thing that's different on the flyers.
Right. Mm-hmm. So when you if you contact Kelly and request information, make sure that you tell her your location so that she can send a specific flyer for your region. And so Kelly has shared her email in the chat. So for those of you who are interested in getting any of those supplies and or materials, go ahead and you can copy her email and then put it into your email client.
It might also be helpful to know that we've been doing, like I said, a lot of outreach already, specifically in the counties that, Kelly's mentioned. So, the greater Cadillac area, Wexford County, Bay City, Genesee County, Shiawassee, Blue Water, or Port Huron rather. And we'd be happy to do, in person if that's, a preference for you, or just a virtual presentation similar to this one, but not 40 minutes long. I think we've got like a 15-minute kind of pitch, just so anybody else in your organization who'd like to learn about the program, we can kind of tell them again, just the basic information, how to get involved with referrals. We'd be happy to arrange some of those meetings as well.
Okay, great.
Yeah. And just to kind of jump onto that. So if, say Flint refers, it's not just going to be all Flint people, so it's going to be participants from all across the state of Michigan, kind of intermingling within one class. Do you anticipate offering in-person classes when it's safe again? Yes. Yeah. We've run into the barrier about no internet access. And so the Zoom has capability where you can just call in. There's just a dial-in number where you can still interact and hear other patients, but you can't see who's talking or see the coach's screen. And so we do anticipate our actually recognition status is based on in-person. And so we would love to get back to doing that. But at this point right now, it's just going to be virtual until we can do so effectively and safely. Good question. Thank you, Susan.
Okay, great. Any other questions for Jen or Kelly? Okay, if not, we're just going to wrap it up. I also added the link to the webinar survey in the chat one more time. If we would like to unmute ourselves or turn our cameras on to say goodbye, we'll just finish up with a brief salutation. You can always say hello to anyone that you know. You can thank the guests for coming. Otherwise, thank you very much for attending and have a great day.
I don't see the link for the survey.
Okay, I'll put it in one more time. So just open up your chat. I'm going to add it and it should be right at the very bottom of the chat.
Huh. Yeah, I don't see it either.
I think you might be sending it to a private.
Oh, maybe. Huh.
Yes, I don't see it.
There it
you
is.
go.
Okay, I got it now.
Oh, thank you
Thanks.
so much
Thanks,
for
lady.
telling me. And I apologize to whoever I sent it to 50 times. Thanks, everyone. Thank you for the presentation. We look forward to seeing you again from
Thank
the
you so much.
YMCA. And thank you,
Thank you,
everyone, for
Portia.
attending. You're
Thank you.
welcome.
This is Dara. Thank you so much, Portia, for the links and the connection to this.
You're welcome, guys. Keep an eye out because we have a lot more exciting things coming up. Specifically, we have Black male perspectives of COVID-19 and vaccinations coming up on April 9th. So keep an eye out for that. We have Dr. Kwame Francis. He's going to be giving his perspectives on the COVID-19 vaccination and access, including a talk about the social determinants of health. So stay tuned for that, April 9th.
Thank you.
All right.
Bye, everybody. Have a great day. Thank you to our speakers.
Bye-bye.
If anyone has any questions about your certificates or your registry account, just go ahead and email me and I'll put my name in the chat and I will share it with everyone. Bye, everybody. Have a great day.